21. What do orthostatic vital sign changes suggest for a patient with acute abdominal pain? Answer: B. A positive tilt test in a patient with acute abdominal pain suggests that the patient is hypovolemic and may have impending shock. 22. A patient with an acute abdomen who shows no signs of hemorrhage and has stable vital signs should be positioned in? Answer: A. Medical patients who are stable should be in a position of comfort. 23. Focused examination of the abdomen of a patient who is complaining of abdominal pain should consist of. Answer: C. Use only gentle palpation in the field. Properly performed auscultation for bowel sounds takes several minutes and is of little value to your overall treatment regimen. Correctly performed percussion requires a relatively quiet environment and an experienced hand to be of any diagnostic value. Continued assessment for rebound tenderness will aggravate the patient's discomfort and is unnecessary once you have determined the patient has abdominal distress. 24. Your patient is a 28-year-old diver who has been using scuba equipment. His diving partner states that he was unconscious when he surfaced after a dive. You should suspect. Answer: C. Air embolism presents as neurological deficit, including unconsciousness during or after ascent from a dive, or as sharp pain in the chest. 25. Drug dosages are lower in elderly patients than in young adults, primarily because elderly patients. Answer: B. The dosage of many common medications is up to 50% lower in elderly adults, primarily because of a decreased rate of elimination of the drug by the liver and kidneys. 26. Which statement about the pain that accompanies a myocardial infarction is incorrect? Answer: C. The pain of MI is not generally relieved by sublingual nitroglycerin. An intravenous morphine or nitroglycerin is usually necessary. It may have all of the same characteristics of angina, making a diagnosis by EMS providers relatively difficult. 27. Which set of vital signs is consistent with left heart failure? Answer: C. A patient with left heart failure will present with elevated blood pressure, elevated and sometimes irregular pulse, and labored respirations. 28. Which of the following conditions would not result in an increase in a patient's PaCO2? Answer: C. PaCO2 measures carbon dioxide levels in the blood, which are influenced by alterations in CO2 production or elimination. Such levels would be increased by physical exertion of muscles, by hypoventilation, or by an airway obstruction. 29. The volume of air normally inhaled and exhaled during each respiration is called the. Answer: A. Tidal volume is the amount of air that moves into and out of the lungs during the respiratory cycle. Minute volume is the total amount of air exchanged in the lungs in 1 minute. Inspiratory reserve is the extra air that could be inspired in addition to the tidal volume. Total lung capacity is the sum of the inspiratory reserve, tidal volume, expiratory reserve, and residual volume. 30. Which vital sign pattern is most likely for this patient? Answer: C. The vital signs given in this choice are most likely for a patient with CHF who is complaining of difficulty breathing. 31. Which of the following are common medications associated with patients with chronic CHF? Answer: D. Diuretics, potassium, and digoxin are the common medications used to treat CHF. 32. You auscultate the patient's chest. What lung sounds would expect to hear from this patient? Answer: B. The pulmonary edema associated with CHF commonly results in rales and/or rhonchi, especially in the lower lobes. 33. Which of the following best describes the pathophysiology of CHF? Answer. A CHF results from the cardiac muscle's inability to pump efficiently. 34. What is the purpose of performing the Selleck's maneuver? Answer. D. Selleck's maneuver is used to prevent patients from vomiting during intubation. 35. Overinflating the pilot balloon in an endotracheal tube can cause. Answer. C. Excessive pressure against the delicate soft tissue of the lower airway may reduce blood flow to the site, causing ischemia. 36. To ensure proper placement of the endotracheal tube, you should. Answer. A. To ensure proper placement, always confirm by two different methods. After watching the tube pass through the vocal cords, assess the chest for breath sounds in numerous locations and chest expansion. Then check the proximal end of the tube for breath condensation. You may also use one of several commercial confirmation devices that monitor end-tidal CO2 or provide an audible whistling sound to confirm air movement. 37. The digital intubation method is used for patients who. Answer. D. Because the digital method does not require hyperextending the patient's neck, it is used for patients with suspected spinal or cervical injury. 38. Distended neck veins, diminishing unilateral breath sounds, and progressively worsening compliance are indications of. Answer. C. Excessive pressure inside the thoracic cavity due to the tension pneumothorax will result in all of the described symptoms. 39. When suctioning a patient, you should always. Answer. Attempts at suctioning should be limited to no more than 5 to 10 seconds, depending upon the level of consciousness. You should ventilate the patient after each attempt, and you should not turn on the apparatus until the catheter is placed properly. In the case of a suction catheter that has a hole in the system that allows you to control if suction is being applied or not by occluding the opening, you should only suction upon withdrawal. This system may remain turned on at all times as long as you monitor closely when suction is actually being applied to the patient. 40. Your patient exhibits cold, clammy skin, air hunger, distended neck veins, tracheal displacement, and absent breath sounds on one side. You should suspect A. The signs and symptoms of tension pneumothorax, the presence of air in the pleural space, and medial sternal shifting are listed.